This is the second video on cranial nerves. The seventh cranial nerve is the facial nerve. Like the trigeminal nerve, the facial nerve is both sensory and motor. CN7 has 4 different nuclei, which gives it 4 different functions. Most predominantly, the facial nerve controls the muscles of the face, giving us the ability to have facial expressions that show happiness, fear, anger, pain, and so on. It is responsible for the sensation of taste, specifically on the anterior 2/3 of the tongue, and it can play a role in the parasympathetic system as it regulates and moves 3 of the major glands in the face. The facial nerve can also receive sensory input from the external ear. Next up is CN8, the Vestibulocochlear Nerve. This sensory nerve regulates all hearing and balance. In the inner ear, the cochlea is connected to 3 semicircular canals. The vestibular part of the nerve takes signals from these canals to help our brains identify our positions and orientations. This helps us with balance and movement. The cochlear portion of the nerve is crucial for hearing. Small hair cells in the cochlea receive pressure waves that we call sound. These signals are then sent to the primary auditory cortex via CN8 to be processed. Because of this nerve, we can tell the difference between a kitten meowing and a thunderstorm crashing. The ninth cranial nerve is the Glossopharyngeal Nerve. Its motor function is expanding and contracting the pharynx. It also has sensory responsibilities, like transmitting taste signals from the posterior 1/3 of the tongue, receiving input from the throat and tonsils, and identifying blood pressure and gas levels. The glossopharyngeal nerve also helps with saliva secretion. The vagus is the 10th cranial nerve. Latin for wandering, this is the longest and most complex cranial nerve. This nerve handles everything from the sensation of digestion to letting us breathe. Many of the sensory input of the vagus is from the heart, lungs, GI tract, and gallbladder, making it the cranial nerve that controls the most of the autonomic nervous system. It also has motor functions like moving food through the GI tract and stimulating our cardiac pacemaker cells to change our heart rates. When patients have their throats swabbed at the doctor's office, they typically gag. Though this is undoubtedly the worst part of a doctor's visit, at least it means your vagus is working. The 11th cranial nerve, the spinal accessory nerve, is a motor neuron that controls movement of the sternocleidomastoid and the trapezius muscles. These help us move our heads. This nerve controls contralateral rotation and ipsilateral flexion. So that means, if the right spinal accessory nerve was damaged, rotation to the left and shoulder shrugging on the right would both be impeded. Additionally, this nerve has 2 parts, the cranial part and the spinal part. The cranial part goes on to combine with the vagus. Finally, there is the hypoglossal nerve. CN12 is also a motor neuron and is responsible for all tongue movement. By interacting with the trigeminal nerve and the vagus, the hypoglossal nerve lets us form words and stick out our tongues. Damage to this nerve typically results in paralysis of one side of the tongue and can therefore be partially treated with speech therapy. Though 12 might seem like a lot, it is quite incredible that all neck and head function, including vast communication with the autonomic nervous system, can be controlled and regulated with only these nerves. This ends the video on the cranial nerves.